My name is Deanna Swartzberger, and this is the discussion for Nursing Videos Task 33 on placing IV catheter. So the first question to discuss is what are some of the possible complications with placing an IV catheter. First one is you think you're in the vein, but you're not. I've had just recently a case where my assistant, I put the saline, the flush in, and my assistant said, "Yeah, I feel it up here in the vein, not a problem." And then about 20 minutes later, realized the patient's leg was swelling up and that the assistant was not quite correct in feeling that. So it is possible to miss the vein, and then you have to, of course, go ahead and recatheterize. You can also get it's possible to get some infection with the longer indwelling catheters. And we'll talk about things to watch for here in a second. You can wrap too tightly with the tape or the vet wrap, and so what you end up with then is distal limb swelling. So if you're gotta be careful not to wrap your tape too tightly. Another possible complication would be you can get a fever of unknown origin, or just basically the patient spikes a fever. And one of the things that you should be checking if you're not expecting that is excuse me, to go ahead and check that IV catheter and make sure that it's not infected or anything else. Some of the things that you should be checking for frequently with your IV catheterization, you should be checking for things like phlebitis. So you're looking for redness, swelling, warmth in the area, looking for infection, which also have similar characteristics. You may also see a purulent discharge with the infection. You're looking for thrombosis. So you're basically looking for the vein just kind of like stands up on its own without being held off, and it feels kind of thick and kind of ropey. And you should also be checking, make sure the catheter is indeed still patent. So you're looking for that any kind of swelling in the limb, which would indicate that the catheter might have moved out of the vein and you're just putting the fluids perivascularly. So those are the things you should be checking for frequently with your IV catheterization. Some precautions to take to reduce the chance that the animals are going to chew out their catheter or pull it out is, first thing, just your first line of defense is your tape job, making sure that it's difficult for them to be able to just yank it out. So I usually try to tape a little bit of backward pressure on that IV catheter. And then, of course, so you can put another layer of defense is the vet wrap, which makes it harder for them to get right to the catheter site. But the big thing here is really you want to use an e-collar, if at all possible, and that really does prevent them from getting to their IV catheter and their line. And another possibility is I've had to do it with a couple patients, just kind of rig the line so that it runs up their leg, up to the back of their neck, and then goes up. Makes it harder for them to just kind of sit there and chew on it when the line's just kind of laying right in front of them. Even with the e-collar on, if they can get to that IV line, they'll go ahead and chew that. So, like I said, I've done that, just kind of rigged it up out of the way so they can't get to it. And then as far as the proper dilution for heparin to sterile saline, you want to use 4 units per milliliter. And this would be your 1,000 units. To make that up, you would do 1,000 units per 250 milliliters of sterile saline. And that's what you do. And once again, my name is Deanna Swartzberger, and this is Task 33 discussion. Thanks.